Tonight's guest, the First Lady of Nursing, Virginia Henderson. She has revolutionized nursing practice through her theory of the 14 basic human needs and greatly influenced the profession of nursing. She is perhaps most famous for coining the definition of what nursing is today. Thank you so much for joining us, Yolanda.
My pleasure.
How did you come to know Virginia Henderson?
Virginia was my good friend who lived just down the street when we lived in the small town of Forest, Virginia. We were the same age, born in 1897. However, she was born in Kansas City, Missouri.
What was Virginia's home life like?
Well, Virginia was the daughter of Daniel and Lucy Henderson. Her father was an attorney for the natives, and her mother was a caretaker for each of her children.
Wow, how big was her family?
Well, Virginia was the fifth of 8 children. It was a very large family.
What do you find so inspirational about Virginia Henderson?
She was very unique. I noticed she didn't follow what other women were doing. Most women, including myself, got married, especially at a very young age.
How long did your relationship last?
At the age of 21, she moved away to the Army School of Nursing, owned by her uncle, so we were separated by person but never in heart. Over the span of her life, she gained 12 doctoral degrees. I was always a bit jealous when I read her letters.
Thank you for joining us in studio, Yolanda.
Oh, thanks for having me. I love being here for Virginia.
I'm joined by my guest, Dr. Richard.
Call me Dr. Dick, honey.
Okay, Dr. Dick. How did you come to know Virginia Henderson?
I was a part of the research team for one of her projects on patient independence. She wasn't afraid to talk politics or about that women's movement, burning their bras in the street and whatnot.
How do you feel about her as a professional?
Well, I think that she was too outspoken about changing the systems.
Well, Dr. Dick, do you believe she was influential to the medical field?
Her femininity and her political opinions were in the way of a lot of others a lot of the time.
Well, what about her many advances to the field of nursing?
Well, I don't think they were anything special, to be honest.
Okay, well, thank you, Dr. Dick, for those enthralling
Well,
opinions.
thank you, honey.
Yes, wonderful. It was so great to have you on the show.
I'm sure I'll be back.
Yes. We'll be right back after these few messages. Up next, I'll be talking to Natalie Freeman, a recent nursing student graduate who has been studying Virginia Henderson's work for the last few years. Hi, Natalie, and congratulations on graduating and becoming a registered nurse. How familiar are you with Virginia Henderson's theories?
I've only studied Virginia Henderson's theories throughout my research at school.
Natalie, can you elaborate a little bit on those theories for me?
It would take me hours to explain her theories, but to summarize, the 4 theories are involved with health, individual, environment, and nursing.
Can you give me an example of how one of these theories applies to your work as a nurse?
My favorite theory is the nursing theory. For example, nursing assists and supports the individual in life activities and the attainment of independence.
What changes did Virginia Henderson's theories have on your practice as a registered nurse?
The 14 human needs have changed the way we take care of our patients and create more of an independent environment instead of patients always having to be dependent on us.
Thank you so much for coming into studio to talk to us today, but we better let you get back to your patients. Welcome back to Quirky Conversations with Courtney. I'm joined by Mrs. Applebottom. I understand at Yale University you have studied all of Virginia's work. Can you elaborate on some of her indexes and essays that she's written?
So Virginia revised Bertha Harmer's textbook of the principles and practice of nursing, which was used by many nursing schools. Also, she revised the basic principles of nursing, which was such a success it was published in 27 different languages.
27 languages?
Yes, 27. Virginia worked alongside Leo Simmons to write the 4-volume nursing research, Survey and Assessment. The index included revising every piece of nursing research published in English. Virginia rewrote Harmer and Henderson's textbook on the principles and practice of nursing. After publication of the textbook, the International Council of Nurses asked Virginia to write an essay on nursing that was relevant worldwide to nurses, patients, both sick and well. The essay was completed in 1960, and it was wonderfully done. The basic principles of nursing was crafted from the essay and became a 20th century equivalent to Florence Nightingale's Notes on Nursing, and is still used worldwide today.
Wonderful. You are so knowledgeable, Mrs. Applebottom. I'm honored to introduce our final esteemed guest, Virginia Henderson herself.
Thank you so much for having me here today.
So, Virginia, can you please tell us a little bit about yourself and about your work?
Well, Ms. Corbett, I am so grateful to be deemed the First Lady of Nursing and also the quintessential nurse of the century. I have been so privileged to be a nurse for the last 80 or so years.
Well, Virginia, where did you start?
I worked in the hospital for 2 years, and then I was so inspired to become a nursing instructor. Then I went on to become a research associate at the Yale School of Nursing. After that, I was so grateful to be granted emeritus status in 1971.
You are perhaps most famous for coining the definition of what nursing is. Are you able to tell me what that is today?
Well, I believe that the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery, or peaceful death. That he would perform unaided if he had the necessary strength, will, or knowledge.
It was so lovely to have you here.
It was absolutely my pleasure. Thank you guys so much for having me tonight.
That concludes tonight's show of Quirky Conversations with Courtney. Tune in next week for who knows what we'll be talking about. Catch you then. Bye for now.